everyone, and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you information on a wide range of interesting and important health topics, and to introduce you to the great people doing important work across our community. Today, I'm joined by Ledgelight's two public health nurses, Chris Magnussen and Mary Day. They are joining us today for a follow-up on the current coronavirus pandemic. Thank you two for joining me.
Thank you.
Thank you for having us.
So it's a busy time to be a public health nurse. Tell us a little bit about what it's been for you guys this past 2 months.
It's been 2 months. I thought it'd been a year. It seems like it's been a year. Mary started what, March 1st?
Yeah, March 1st.
Yes. So tell us, Mary, because this is all new for you.
Well, I jumped right into this new job just in time for the start of the pandemic. We have spent a lot of time doing education before everything closed down. So we were going out into the community, teaching people about, the best way to stay safe with in preparation for coronavirus. And we have been lately very, very busy doing contact tracing. So contact tracing is a public health tool. It's one of the best tools that we have to try to contain the spread of any kind of disease during a pandemic. So what that involves is reaching out to positive cases, contacting them, and then also finding out who their close contacts have been. So the past few weeks, we've been really busy, I would say largely with contact tracing, as well as helping to oversee volunteers and training them to help us with contact tracing as well.
It's been a busy time. A lot of phone calls.
I know. I think the phones
probably
ringing.
the one positive is that people realize what we do. Public health, we tend to be in the background and we tend to get things done so that we don't have outbreaks, and then, they know about us. But I think too, what's been good is that partners that we knew of, but maybe didn't spend a lot of time with, we're getting to know really well. So I think going forward, we have much stronger relationships with so many partners and communities. So that's been a real positive, even though we're tired. We're all tired.
Right. Now, the name of the game is really testing right now. We're hearing testing is so important for figuring out when businesses can reopen and figuring out how far this has spread. Has it become easier to get a test? Have the guidelines changed?
No, the guidelines haven't changed. It's just that there are more tests available, and there are more private labs that now provide it. And some businesses have actually purchased kits for their businesses. So ideally, somebody should not be tested unless they have symptoms, because the incubation time from the time they could get infected till they show symptoms could be 2 weeks. So if somebody just goes to get tested to see if they have it, oftentimes they won't be allowed to be tested unless they have symptoms. That said, we have seen that there are a lot of people out there without any symptoms who were tested as part of some studies and were found to be positive. So I think as it opens up, the hope is to just test more and more of the population, regardless of symptoms or not.
And one exception to that, if I could jump in, is if you are a healthcare worker, you can get tested even if you don't have symptoms. And as Chris said, we are seeing lots of asymptomatic positive COVID-19 cases. So realize that healthcare workers without symptoms can also get tested.
Yeah, that's a good point. Very important that we look out for our healthcare workers. I know you two are speaking a lot with people who have tested positive for coronavirus. Are you seeing a lot of consistency of symptoms, or are they really varied?
There's been a broad range of symptoms. And at first, when we were learning about coronavirus, we were hearing the most common symptoms, reported to us being fever, cough, shortness of breath, at least what we were hearing from the CDC. As time has gone on, we have realized that there's a very broad range of symptoms and that COVID-19 affects people differently. So we've seen everything from muscle aches, severe fatigue, diarrhea, even dizziness, even nosebleeds. Symptoms, some of them less common, but it really helped us to understand that COVID-19 is not one classic presentation. Also, too, something that's very specific to COVID-19 is the loss of smell or taste. And research came out, a few weeks after COVID-19 reached the U.S. Research was coming out that a lot of people were reporting this loss of smell or taste. So that became one symptom that is very specific to COVID-19.
We've been having a lot of people, when we've interviewed them, complain of severe headaches, and they assumed it was sinus. And that's what's been difficult sometimes, is that we're in that time of the season with allergies where people do get allergic reactions and do sometimes get sinus infections. And so we've heard that from a lot of people, that I didn't think anything of it, I just thought it was my sinuses acting up. So I can only say for the ones that I've done that I don't see fever that often. And if they do have a fever, it's not always the first symptom. And a lot of them will say that they just have a fever for maybe a day. So as Mary said, they're varied. They're all over the place, but predominantly we're seeing a lot of people say they have backaches, muscle aches, fatigue, headaches, loss of sense, smell, and taste.
Wow. It could really be anything. People have to be super careful. Across the state, the number of cases has really been varied from the numbers that I've been looking at and people have seen on the news. And it seems like Eastern Connecticut early on was sort of spared. Do you think that there's going to be a surge anticipated, in Eastern Connecticut, and what might factor into that?
Well, I think there'll probably be a surge because we've certainly been hit, and some of the models show that we've yet to surge. Although we're at that point in May where there was talk of a surge. I think the other end of the state being close to New York, that's what impacted them. And so as they got impacted and we began to learn more about COVID and to see what needed to be put into place, that allowed us at this end of the state to be a little more prepared. So I think we have to be realistic that in a pandemic that we're going to see highs and lows, we're going to see peaks and valleys, and that we have to be prepared and not let our guard down at all.
Right.
And to add on, factors that could affect whether or not there's a peak or a surge, this summer will be things like if we start to relax social distancing or wearing masks. So, it will be, and even things like hand washing. So it will be really interesting to see what happens. And again, different health models are predicting different things in terms of, spikes of the illness.
Right. So it's a lot of wait and see, and hopefully people continue to follow the guidelines. Tell me, we started the segment today talking a little bit about contact tracing. We know it's important. We keep hearing about it on the news. What are we doing here at Ledgelight? Have we been training people to do this, or explain to everyone the process that we're doing?
So here at Ledgelight, we developed a data collection and contact tracing tool, which is a tool that we use to interview positive cases. We ask them to confirm personal information, such as, date of birth, address, occupation. We ask them about the date of their onset of symptoms and what symptoms that they've been having related to COVID-19. We also ask them information about close contacts. So who have they been in close contact with. And we also ask them exposure-related questions and some health history questions. This provides us with a lot of data so we can start to understand who this is affecting and who is mildly impacted versus who is severely impacted. And then this also, of course, gives us an opportunity to provide education on, self-isolation, and it allows us to be able to reach out to the close contacts who may otherwise not know that they have been potentially exposed.
Wow,
So
this is super important.
It is, and this is a tool that's been used for many, many years. We do it for tuberculosis and STDs because we want to stop the transmission. And the only way we can do that is to have people quarantine. Basically, we want them to stay in their home, away from others, so that if they get sick or getting sick, that it's not going to impact somebody else. That's the only way. And so we really need to have people understand that, especially now that we have the new program in Connecticut going forward on contact tracing, that people are going to be calling them if they're positive for COVID. And they need to answer these calls because this is how we're going to really stop the transmission. And then hopefully down the road with a vaccine coming in place, that then there'll be the herd immunity and then we can open up and maybe life can go back to the way it used to be. Oh, maybe somewhat, hopefully. So we've got a great team of folks that have been doing contact tracing. And I think probably the most frustrating thing is trying to reach people and having people willing to talk to us so that we can get this information. And anybody who is positive with COVID, they need to stay isolated away from everybody for at least 10 days. And these are the things that we want to go over with them and talk to them about how to keep their family safe and how they can take care of themselves. So just please, I hope, as Mary said, that people continue to pay attention to the guidances that come out about social distancing and masks so that you don't get sick, so that we don't have to call you.
Good point. I think we should take a quick break and we will meet right back here for the second segment of Healthwatch.
What is the 2020 census? Every 10 years, the census records everyone living in this country. It's written in the Constitution and comes in a questionnaire that counts everyone who lives at your address on April 1st. The data can be used to inform funding for services like fire stations, schools, clinics, and representation that affect your community.
How will 2020 census data be used? Where there are more people, there are more needs for public services. That's why the census is used by the government to inform funding decisions each year. But that's not all. It's also used by nonprofits to inform services, by businesses to create jobs, and even by students for school projects. Understanding how the population changes helps us shape communities across the country for the better.
How does the 2020 census affect representation? There are 435 seats in the House of Representatives. These get distributed to the 50 states by population, and an accurate census response helps your state get the right amount of seats. States with smaller populations get at least one, while states with larger populations might get more.
How do I take the 2020 census? In March 2020, every address in the country will receive an invitation to complete a simple questionnaire. And there are 3 ways to respond. Number 1, do it online. Number 2, call by phone. Number 3, send it by mail. For those who don't respond, a census taker from your community will follow up and assist you.
Is my 2020 census data safe? After sending your census response, your personal information is kept safe. By law, it can't be shared with any other government agency, law enforcement, or landlord. No one. So take your 2020 census with peace of mind. Shape your future. Start here. Visit 2020census.gov.
Welcome back to Healthwatch, everyone. Thanks for tuning in on this virtual edition of Healthwatch. I'm here today with our 2 public health nurses from Ledgely Health District, Chris Magnussen and Mary Day, and we are doing a follow-up to our first episode back in March on coronavirus. 2 months later, we're taking a look at everything and what we know now and where we're going. So we finished up the first half talking about contact tracing, which right now is one of the more important things that's happening. We keep hearing about the importance of it so we can help stop the spread of the virus. Let's talk a second about long-term care facilities. We keep hearing about nursing homes and how they've been particularly hard hit. We know that this happens with a lot of different diseases and illnesses. Tell me, why do you think these facilities have such a difficult time?
You know, you've got a population that's vulnerable. They're elderly, they're chronic illnesses, they're living together, oftentimes 2 to a room. I think too, you have to keep in mind that oftentimes it's a closed system in there. We're not sure about HVAC, how that may be playing into it too. I think what's really difficult is that these long-term care facilities have been working really hard from the beginning to do what's right, but there's been a lot of changing guidances along the way. To begin with, people were told masks weren't needed, then masks were, and so I don't think that we can really fault the facilities because they were following the guidances at the time. Also, PPE, personal protective equipment, masks were in very short supply. So I think, you know, we have to realize that this is just a very at-risk population. You have staff that are coming in and out. Now they're all wearing PPE as directed. And I think they're doing the best that they can to keep their residents safe. For many of the staff, these residents become their family. And so I think it's important for people to know that, you know, it's not that anybody's doing a bad job, contrary to what people think. I think they're all working really hard to do what's best for their residents. You know, and they're being impacted too. And we're discovering as more point prevalence testing is being done, which means they test on a particular day, everybody. We're finding that facilities are finding that some of their residents who appear healthy are in fact positive. So I think this is what's so difficult, is that we have people that are working in these facilities with no symptoms, no fevers, that could have been passing it on, and that could have been how it started at the very beginning. So, and you know, I know it's been very difficult for the families not to visit, but hopefully down the road, I think that's beginning to loosen up a little bit, at least.
Right. A lot of people are working from home, but many people can't. What are some ways that workplaces can adapt to our current challenges?
I think we get calls from workplaces. Mary and I have had to deal with a lot of workplaces. And I think what's important is workplaces need to understand that they have to follow OSHA guidance. And OSHA has put out guidance on COVID-19. Plus the governor has put out a lot of guidelines and public health requirements that people need to wear masks when they're out in public. So if you have to wear a mask out in public, then it goes to reason that you should be wearing a mask in the workplace if you're around other people. So I think it's important to just keep in mind that there are regulations out there that people need to follow, but also even if there weren't regulations, people need to respect one another and be careful and do what's right. I know Mary's dealt with a lot of companies as I have, and I think for a lot of them, they're just not aware that there are all these different guidances and rules and regulations that are coming out about COVID-19.
Yes, and in general, a lot of the guidance is recommending that workplaces are modifying their environment so that they can facilitate, 6 feet apart between employees in their workspace. Other things that we're seeing, shields are getting put up to protect like front desk staff, for example, or as you've seen at the grocery store, people at the checkout line, the plastic shields are a barrier between the customers and the employees. And then just, having routine disinfecting and having, cleaning products available so that employees can disinfect their own workspace. And then as Chris said, enforcing wearing masks.
Right, so a lot of important considerations there. I'm sure that both of you have noticed the weather is getting warmer. And I think that some people might be having some corona fatigue, as I have affectionately been calling it. Can people ease up on masks now? I didn't think that was the guideline, but I'm certainly seeing it. What would you say?
Absolutely not. People can't let their guard down. This is going to be going on for quite a while, and people need to make the mask part of their outfit. And if they're out walking and there's nobody around, then they can take their mask off. But when you're around other people, especially within 6 feet, you've got to have that mask on. If nothing else, you've got to respect other people. You could be a carrier and not know it. Just because you don't have any symptoms doesn't mean that you can't be an asymptomatic carrier. So no, and I want to also just bring up a point that I see too many people walking around like this with their mask not over their nose. It's a respiratory disease, and so you're breathing it in. So I just want to remind people that it's got to go over the nose and the mouth. And then also continue at all times to keep those hands clean and away from your face. And just respect the 6 feet, at least 6 feet from others.
Yeah, that's a really, really good point. We're already hearing about fall and winter. We haven't even hit summer yet. We're talking about flu shots already and talking about how far this is going to go. Should people be planning on a flu shot this coming year?
Yes, people should plan on getting their flu shot this year. The flu comes around every season, and just because we're in the middle of the COVID-19 pandemic doesn't mean that the flu won't make its annual appearance. So people should plan on getting their annual flu shot.
Yeah, that's really important.
It's going to be a difficult season, flu and COVID. So we know that you can protect against the flu, so why not get your flu shot? And every year, Ledgelight has been doing drive-through flu clinics and preparing just for this, but we didn't think it would be this soon. So if you happen to come to one of our drive-throughs, you'll see that everybody will have to wear masks if they're going to be allowed through, even though they're sitting in their cars.
That's a good point. I remember last year when we were doing our exercise, we asked people if they would be comfortable wearing a mask.
We only had one person who didn't.
And boy, have the times changed.
Little did we know that we were practicing for the real thing.
Right. That time it was bird flu, I believe we were pretending it was. So as we hear about states pushing to reopen and trying to get back to normal, what do you want to say to the public about being safe during this time? What are the things that you really want to drive home to everybody, make sure they understand?
Well, just because things are starting to reopen doesn't mean that, again, we can't let our guard down. We have to pretend that everybody we come in contact has the potential to infect us. And if we try to remember that, then hopefully people will continue to wear their masks, which they're supposed to. Make sure that they're doing social distancing. Please don't go out places if you don't feel well. Please pay attention to what's posted on doors before you enter. Every establishment will probably have certain things they want you to abide by, and it's for your health and the health of everybody else. I wish, Mary talked about contact tracing earlier. I wish that that people would keep track of where they're going. Just mark on your calendar. So if God forbid that you get COVID and we call you to interview you, that you can tell us where you've been so that we can alert people to quarantine for 2 weeks. And that's the only way that we're going to prevent the transmission, is if everybody works together to follow all of these guidelines. And hopefully we won't be calling any of you, because you're going to follow these guidelines. I know you will.
Right. And I have to say thank you. I know you guys have been working around the clock in all the different roles that you have on this. It's really been an unprecedented time. And I just want to thank you for taking the time to join us again here. I recall early, about 2 months ago, when we first started talking about coronavirus, I had the opportunity to do video about proper use of PPE, and boy, have we grown from that. It's just a very interesting time. So thank you again for joining me today on Healthwatch. To all of you tuning in, I hope you'll join us next time here on Healthwatch.